All right, students, this is the final section of your chapter 24. And again, this is an overview of diagnostic tests and specimen collection. This is part 3 of 3 parts. And in this particular section, you're going to be able to describe each of the categories of tests that are commonly performed. This is a continuation of the presentation we've discussed earlier today. And also, you'll be able to explain factors to be considered when an older adult is undergoing diagnostic testing. This content on this presentation begins in your textbook on page 425. In this section, you'll bring the following knowledge to the clinical practice setting. You'll be able to describe how to prepare a patient for and assist your patient with aspiration procedures such as a lumbar puncture, thoracentesis, paracentesis, bone marrow aspiration, and liver biopsy. You'll gain information and skills on correctly using standardized precautions whenever obtaining or handling specimens for diagnostic tests. You'll list the steps for assisting with a pelvic examination and Pap test, and correctly filling out laboratory tests and test requisition forms. Let's discuss the various types of endoscopic examinations. These are examinations that use endoscopes, which is an instrument that views inside an individual's body. One kind of procedure is called a gastroscopy. This procedure visualizes and inspects the upper digestive tract and stomach. It obtains specimens of gastric contents and performs a biopsy of the stomach's tissue. This procedure uses local anesthetics, which is sprayed on the pharynx, and a gastroscope is passed through the stomach. The scope has a fiber optic system for its lens. A gastroscope may be equipped with a camera to take color photographs. This is considered an invasive procedure, and it is certainly important to ensure that the patient is well informed regarding this procedure and has signed a consent for this procedure to be performed. The procedure requires that the patient have nothing by mouth for 8 hours prior to the examination. Your proctosigmoidoscopy requires consent as well. Is visual inspection of the lower bowel to check the lining for ulcerations, polyps, tumors, inflammation, and other abnormalities. The sigmoidoscope is inserted. The fiber optic lens enables examiners to see these structures. Sections can be removed for secretions. Air may be introduced to inflate the lower bowel to better view the wall, and biopsy forceps may be used to remove any tissue for sampling. The bowel should be clear of fecal matter, therefore, patients are given bowel regimens the night before the procedure or even an enema. The patient may be restricted to a liquid diet the day before the test is performed. Also, patients should empty their bladder before the test and then assume a side-lying position on the table. In your textbook on page 426 provides you with information on assisting a patient with this type of procedure. Please familiarize yourself with the steps. A colonoscopy is used for inspection of the entire large intestines for polyps, areas of inflammation, and malignant lesions. A long, flexible fiber optic endoscope is inserted anally and slowly advanced through the large intestine. It should not be done sooner than 10 to 14 days after a barium study is conducted. Any iron medication, aspirin, and most of anti-inflammatory drugs must be held for 3 days prior to the procedure. A cystoscopy is the visualization of the interior of the bladder. Cystoscopy is used for the collection of biopsy specimens, collection of urines separately from each ureter, and treatment of various conditions. A cystoscope is passed through the urethra and the bladder is visually inspected. The aseptic technique is used throughout this procedure in order to avoid introducing any microorganisms or the possibility of passing or causing infections in the urinary tract. Your endoscopic retrograde cholangiopancreography is your ERCP. Why is this usually done? The ERCP is done for individuals who present with jaundice or yellowness of the skin, or jaundice of mucous membranes, and sclera, which is the presence of bile pigments. ERCP is used to identify a cause of biliary obstruction and strictures, cysts, stones, or tumors. An endoscope is inserted through the mouth and into the duodenum after intravenous sedation. A catheter is inserted into the pancreatic duct via the endoscope and a contrast medium is injected. X-rays are then taken. The individual should have nothing by mouth 8 hours before the procedure. This is certainly an invasive procedure, and a sedative, narcotic, and atropine are given in preparation for the insertion of the endoscope. Patients must consent for this type of procedure. After the procedure is conducted, vital signs are monitored every half an hour for 2 hours and then hourly for 4 hours or until stable. The patient's gag reflex must return before foods and fluids are introduced or reoffered. Please refer to your textbook on page 427 regarding information for the ERCP. There are various types of aspiration procedures, and as your role as the nurse, you are to ensure that the environment is to maintain sterile during the entire process, and you are also responsible for obtaining any equipment and setting up the patient and the environment for the procedure. So make sure that you are fully aware of the procedure that's going to be conducted and any equipment that you might need prior to the patient coming for the particular procedure. So be well prepared and maintain sterile technique at all times when aspiration procedures are being conducted. These procedures are used to obtain bone marrow, liver cells, spinal fluid, abdominal fluid, or fluid in the chest cavity samples. They're usually performed at the bedside or in a procedure room by a physician, and it is essential that the patient remains still during these procedures. An electroencephalography, or your EEG, is used for the tracing of brain waves. The EEG is done to localize and diagnose brain lesions, scars, epilepsy, infections, blood clots, and abscesses. It is also performed to determine brain death on individuals who are on life support and who are in comatose state. Patients who are scheduled for EEG are not to have any stimulants, sedatives, or anticonvulsive drugs such as Dilaudid up to 48 hours before the test unless it's needed to control seizures. Other diagnostic tests include blood specimens, wound or throat cultures, random blood sugars, hemoglobin levels, urine dips, or your pap smears. Diagnostic testing in older adults. Older adults often react differently to invasive procedures. Older adults often have several problems that may interfere with doing the procedure. Always ask older adults if they have any questions or need special accommodations. Safety precautions must be implemented to protect patients during diagnostic procedures. Please ensure that you assess your patients and your older adult patients for any special safety considerations. Okay, this is question number 5, and this is our final question for the chapter 24. This will conclude our presentation for chapter 24. So let's look at this final question. Melissa's patient now needs an aspiration. She's very nervous about the procedure, and Melissa explains to her patient that an aspiration is performed by A flexible fiber optic instrument, B, injecting a needle into the abdomen, C, extracting fluid or tissue from the patient, or is it D, inserting a needle through the chest wall into pleural space to remove air? What is an aspiration? So aspiration is C. Is extracting fluid or tissue from the patient. Endoscopic examinations are performed using a flexible fiber optic instrument. A paracentesis is performed by injecting a needle into the abdomen and removing fluid. And a thoracentesis is performed by inserting a needle through the chest to remove air. Please remember and familiarize yourself with these various types of aspiration techniques. The end. This concludes my presentation on Chapter 24 of your textbook, Diagnostic Tests and Specimen Collection. Please ensure that you review all 3 parts and read the chapter in its entirety. Thank you and have a nice day.